Welcome to the Maryland Prescription Drug Monitoring Program RxGov Investigative User Training webinar. Viewing this webinar in its entirety is a requirement to gain an account with RxGov to make PDMP requests as an investigative user. During this training, we will provide some basics about the Maryland PDMP. We will go over information important to you as an investigative data requester, including your legal authority and requirements to make requests. We will show you how to use the RxGov system to make your requests and retrieve approved reports. Then we will conclude by reminding you about next steps to creating your account and points of contact if you ever have questions in making requests from the Maryland PDMP. Let's start with some basics about the Maryland PDMP. It's well documented that there's a national overdose epidemic driven in large part by prescription opioid misuse and the availability of opioids. In Maryland, we have seen increases in heroin and fentanyl-related overdoses, and we know that there is a sustained elevated prevalence of prescription opioid misuse in Maryland. PDMPs are an important tool for allowing a wide range of stakeholders to prevent, identify, and intervene with opioid use disorder and diversion of controlled substances. Maryland serves a large number of those stakeholders by providing PDMP data access to those who have a role to play in combating the opioid crisis. What is the Maryland PDMP? The Prescription Drug Monitoring Program, or PDMP, is a secure electronic database with information about controlled dangerous substances that are dispensed in Maryland. The program by law makes these data available to healthcare providers, law enforcement agencies, health occupation licensing boards, certain agencies within the Maryland Department of Health, or MDH. De-identified and aggregate data are also made available to researchers and public health professionals, and patients and prescribers can always request an accounting of what is attributed to them within the PDMP. In Maryland, the PDMP is administered by the Maryland Department of Health, or MDH. The program was established in law in 2011, and regulations governing the program became effective in 2012. The original system went live in December of 2013 for clinical users in CRISP, which we will discuss later. And in March of 2014, we began investigative request processing. We have been migrating to a new vendor as of spring of 2019 to handle data collection and investigative users. You will be learning in this training about how to make requests in the new vendor product called RxGov. The goals of the Maryland Prescription Drug Monitoring Program come from the original authorizing legislation. They are to assist pharmacy, medical, and public health professionals in their identification and prevention of prescription drug abuse. At the same time, we assist law enforcement and other regulatory agencies in your identification and investigation of illegal prescription drug diversion. Throughout all of our program activities, we promote a balanced use of the data to ensure that we preserve the professional practice of healthcare providers and legitimate patient access to optimal pharmaceutical-assisted care. PDMP serves as an important clinical tool for prescribers and pharmacists across Maryland. Additionally, the PDMP is an important tool for our investigative users. As an investigator, you will submit a subpoena or request form listing a specific patient or drug recipient, prescriber, or dispenser who is the target of your request, and you will receive a data report. For every subpoena that you submit, you can list up to 10 names on that single subpoena for individuals related to the same investigation. For every data request that you submit, we will deliver a report with all CDS prescriptions that were dispensed in Maryland over the requested time period. This allows you to receive a report that is statewide without going to every single individual pharmacy or other data access points separately. Before we jump into specifics about the data collected in the Maryland PDMP, let's look at the national context. Almost every state has a PDMP, and while we all have very similar provisions and data access, there are some nuances to the Maryland statutes and regulations. We will be going over those in today's training. One thing to note is that while Maryland does engage in interstate data sharing, allowing our clinicians access to data from our surrounding states and a few other states so that our clinicians here in Maryland can make good decisions accessing Maryland and other state PDMP data, interstate data sharing is limited to clinical users only. When you make requests from the Maryland PDMP, we will be providing data solely from our own Maryland PDMP database. If you would like information about prescriptions dispensed in another state, even if it's for a Maryland-based prescriber or a Maryland-based patient, you must go to that other state's PDMP for data access. So how are data collected into the Maryland PDMP? Beginning back in August 20th of 2013, all dispensers have been required to report prescriptions dispensed in Maryland to the Maryland PDMP. Dispensers that are required to report to the Maryland PDMP include hospital outpatient, community and retail pharmacies, and mail order pharmacies that are mailing prescriptions to a Maryland address. Additionally, if a practitioner, like a physician, dentist, podiatrist, are authorized to dispense controlled dangerous substances from their office setting, those practitioner dispensers are required to report to the Maryland PDMP as well. The data that are reported are for all Schedule 2 through 5 controlled dangerous substances, or CDS drugs, dispensed in or into Maryland. Those data are reported electronically using a common data standard and must now be reported within 24 hours of the dispensing occurred. Please note that this is a change. Prior to July 1 of 2019, prescriptions have been reported within 3 business days. We have now moved to every 24 hours reporting, which allows us to provide more timely data access to our end users. The information that is reported to the Maryland PDMP include key fields identifying the patient, the prescriber, the dispenser, and the drug that was dispensed. We will go over a few of the common data fields that you will expect to see in the data report provided to you. If we start with the entire universe of all controlled dangerous substances in Schedule 2 through 5 dispensed in Maryland, there are some exemptions to the reporting requirement and therefore some gaps that you should expect to see in a data report. This is important context for you to understand what you should and should not expect to receive within your data request. For example, direct administration and drug samples provided to a patient will not be reported to the Maryland PDMP. Similarly, pharmacies that serve only hospital inpatients do not report to the PDMP. But as we mentioned, hospital outpatient pharmacies do report their dispensings to the PDMP. The Maryland Board of Pharmacy waivers pharmacies for a number of different reasons. One set of those are for pharmacies exclusively serving assisted living, comprehensive care, and developmental disability facilities. These pharmacies do not report data to the PDMP. Another group exempted from reporting are our opioid treatment programs, or OTPs. This includes methadone clinics and other providers who dispense medication-assisted treatment to patients directly. So, if a prescription is written for methadone and dispensed at that program, or written for buprenorphine or Suboxone and dispensed out of that office, those data are not reported to us. This is because of Federal Regulation 42 CFR Part 2, which protects the confidentiality of drug treatment records. These programs would be in violation of federal regulation if they were reporting data to us. However, please note that if a prescription is written for buprenorphine for substance use disorder treatment, and that prescription is taken to a community or retail pharmacy and filled, Part 2 no longer covers that prescription, and that buprenorphine prescription will be reported to the Maryland PDMP. Therefore, you should expect to see a subset of all buprenorphine prescriptions for substance use disorder available in the PDMP. In a very similar fashion, Veterinarians who are dispensing out of the veterinary clinic are exempted from reporting their dispensed prescriptions to the PDMP. However, if a pet owner receives a prescription for their pet for a controlled dangerous substance prescription and that is filled at a pharmacy, that prescription will be reported to the PDMP. There is a specific field that identifies that prescription as an animal with the species code, and there may be some differences in the way that the name and date of birth are sent to the Maryland PDMP. Finally, pharmacies dispensing to hospice inpatients may be waived from reporting data to the Maryland PDMP. Now that we have talked about what data are and are not included in the Maryland PDMP, let's look at specific fields within the data. As we discussed, every prescription is reported giving information about the drug, the patient, the prescriber, and the dispenser. For the drug dispense, you will receive information like the original prescription number, the date the prescription was written and filled, as well as information about refills. The way that the prescription was paid for is coded as the payment source. All prescriptions are put into buckets based on the type of payment source, including Medicare, Medicaid, commercial insurance, and cash pay. We receive prescriptions agnostic to the way that the prescription was paid for, and so the entire universe of prescriptions should be reported to us. We receive from the dispenser the National Drug Code, or NDC, which we use to populate information about the drug name and strength. You also receive information about the drug metric quantity dispensed and the intended day supply for that prescription. For the patient, you will receive information about the identity of that patient. An important caveat about the way the prescriber and dispenser data are populated, which should be noted as you interpret the data, is that what we receive from the dispenser is the DEA number associated with that prescription for the prescriber and for the dispenser. The data collection vendor then matches those DEA numbers to reference files and populates the identity of the prescriber and the dispenser based on how they have registered with the DEA. Therefore, you will see information on your data report as it was registered with the DEA by that prescriber. This is an important caveat because the prescriber may register a single address with the DEA, but use that same DEA number to prescribe in multiple locations. We advise that you go to the original prescription record or other original records to verify the exact location where that prescription may have been written. So now that we've given you some basic information about the data in the PDMP, let's talk about who can request that data. As we mentioned at the outset, clinicians can use the PDMP data. Prescribers and dispensers of controlled dangerous substances access the data in connection with the medical care of a patient or the dispensing of a prescription drug to a patient. As an investigative user, you represent either law enforcement, licensing boards, an agency with an MDH that is explicitly authorized to access data, or a part of a fatality review team. As you can see, an existing investigation or case review is required for your data access, and you submit either a subpoena or a specific request form to access your data. Additionally, we do engage in interstate data sharing, as we discussed before. This is explicitly and solely for our clinical users. We do provide de-identified data for researchers and public health professionals, and patients and providers may request an accounting of data that is attributed to them in the PDMP. How do we provide this data to all of these different end users? We rely on our IT partners. Chesapeake Regional Information System for Our Patients, or CRISP, is the statewide designated health information exchange for Maryland. It serves as the main PDMP IT contractor and provides for our clinical users a place to register and access PDMP data. Our clinicians log into the CRISP web portal to view PDMP data or are shown PDMP data through electronic health record integrations. Investigative users access PDMP data through the RxGov product provided by NIC. NIC serves as CRISP's PDMP contractor for data collection and our investigative request processing. Therefore, as an investigative user, you will register for, submit data requests, and access PDMP data reports through the RxGov system. You will not create an account in CRISP, nor will you ever access data through CRISP. Let's review some important legal provisions around PDMP data access. The Maryland PDMP data and reports based on Maryland PDMP data are confidential, privileged, not subject to discovery or subpoena in civil litigation, and are not public records. In Maryland, prescribers and dispensers are required to register with the Maryland PDMP and to access PDMP data in certain clinical decisions, including prescribing and dispensing of opioids and benzodiazepines. Specifics about this use mandate, which was effective July 1, 2018, is available on our website. There is a civil penalty for any dispenser who fails to report data to us, and a criminal penalty for unlawful data access and use. Any individual or entity that has legally authorized to access PDMP data is trained in the legal authority and requirements for that data access and use prior to receiving access to the data. Please note that currently the program may not initiate referrals to law enforcement, licensing boards, or other regulatory entities. However, beginning October 1 of 2019, the program will be authorized as a statute change will go into effect for referral in limited cases of situations viewed in the PDMP data to Office of Controlled Substances Administration, which is the state CDS permit authority. Redisclosure of PDMP data is allowed only in the following situations: for cross-agency collaborations on investigations and consistent with HIPAA. Redisclosure is when an individual or entity that has been in receipt of PDMP data shares that data with another individual or entity. If we think about you as a data requester receiving data from the program, that is an initial disclosure from the program to you as a data recipient. Your sharing of PDMP data to another individual or entity is redisclosure. If you ever have any questions about whether or how you can share PDMP data legally obtained through a data request with another entity or individual, please contact the Maryland PDMP office. Relevant to investigators, if you are working on a cross-agency collaboration where you and another enforcement entity have formed a task force or are otherwise working together on an investigation, sharing of PDMP data may be allowed. What you may not do is conduct your own investigation and then determine that you need or should refer an investigation to another entity for them to investigate themselves. If you are making that type of recommendation or referral, you may not pass along PDMP data. That investigative entity must come and make their own individual PDMP data request. Now that we've provided some basics on the Maryland PDMP data, technology, and legal provisions, let's look at you as an investigative data requester. Maryland statute explicitly states who may be given access to Maryland PDMP data. The program may disclose data to a federal, state, or local law enforcement agency on issuance of a subpoena for the purpose of furthering an existing bona fide individual investigation. We may also disclose data to a licensing entity on issuance of an administrative subpoena voted on by a quorum of your board, or for the Board of Physicians, the quorum vote will be for a panel of the board. In both cases, this is for the purpose of furthering an existing bona fide individual investigation. Please note that as defined in the statute governing the PDMP, a licensing entity means an entity authorized under the Health Occupations Article of Maryland statute to license, regulate, or discipline a prescriber or dispenser. Additionally, prescription data may be disclosed to specific units of the Maryland Department of Health on approval of the Secretary for the purpose of furthering an existing bona fide individual investigation. Authorized units include the Office of Healthcare Quality, the Office of the Inspector General, the Maryland Medical Assistance Office, the Office of Controlled Substances Administration, and the Office of the Chief Medical Examiner. Finally, data may be disclosed to the following entities on approval of the Secretary and for the purpose of furthering an existing bona fide individual case review. These entities include the State Child Fatality Review Team, a local drug overdose fatality review team, the Maternal Mortality Review Program, and any medical review committee that is described in the referenced Health Occupations article. As an authorized investigative user, please make note of these requirements for making requests. The subpoena or request form that you will submit to us must identify the unique prescriber, dispenser, or patient who is the target of your request. Your request form or subpoena must include the time frame of your request, so a to and from date for which you would like information about dispensed prescription drugs. You will include a case number signifying that you have an active investigation or case review underway, and that request form or subpoena must be executed appropriately. You may request review of your data report by the Technical Advisory Committee. I will go into exactly the role of the Technical Advisory Committee or TAC, but please note that if that review is desired, you must request their review in the documentation that you electronically submit in RxGov. The Technical Advisory Committee, or the TAC, was established in the original authorizing legislation for the program. Its membership includes 9 appointed members, and they represent areas of healthcare where there are significant prescribing and dispensing of controlled substances. The purpose of the TAC is to provide clinical guidance and interpretation to data requesters in the form of a TAC report. The TAC is authorized to be provided with a copy of the data report that you request. They can review that data and then provide you a short narrative or TAC report that summarizes their clinical guidance and interpretation. By regulation, they are provided 10 business days to review the data report and provide you with a TAC report in response. Please note that the TAC members are not provided with additional context about the scope or intent of your investigation, nor provided access to the subpoena or request form that you have submitted. So they do not have additional context about the investigation that's underway, nor do they at present have access to any other information about the clinical situation or other context of the data within the PDMP. They're making their TAC report solely based on review of a PDMP data report. If you have questions about TAC review of data or use of a TAC report, please feel free to contact the Maryland PDMP office. If your data access necessitates the submission of a subpoena, please take note of some of these requirements. Maryland PDMP accepts court-issued subpoenas as well as authorized administrative subpoenas. Per Maryland Rule 4-266, a subpoena must be issued by the clerk of a circuit court on request of the state's attorney or the grand jury, or by the grand jury through its foreperson or deputy foreperson. Please note that subpoenas signed by a state's attorney are not acceptable for service on state government agencies. Submission of a data request, including a subpoena and a request form, and receipt of PDMP data will be facilitated through a registered investigative user. As an investigative user, you are one of the following: a sworn officer or agent of a federal, state, or local law enforcement agency, an investigator identified by an applicable licensing board's executive director, or an investigator identified by an applicable MDH office director. You're authorized by your agency leadership to submit PDMP data requests on behalf of your agency, and you have received training in the purposes and use of the PDMP, which is what you're doing right now. So how do you become an investigative user? First, you watch the training webinar that you're listening to right now. Then you will submit to the PDMP office completed and signed forms that include an attestation that you have viewed the PDMP training and an investigative user supervisor form, which will be signed by your supervisor. Once those forms have been received by the PDMP office, you will be emailed a link to the RxGov platform where you will complete your registration. You will confirm your email address with RxGov, and then you will receive a second email from RxGov once all of your registration information has been approved by the MD PDMP office staff. At that time, you'll be ready to make data requests from the Maryland PDMP. To facilitate the registration process and accessing data requests after your account has been set up, please make sure you allow emails from rxgovhelp@egov.com to populate in your inbox. Notifications informing you when data requests are approved or denied will come from this email address. Sometimes email systems will try to send these emails to your spam folder. We want to ensure that you are always receiving notifications from the RxGov system, so please ensure that these emails are going to your inbox. Once you've been issued a user account, please always use your individual account to make requests and retrieve reports. The individual account is issued to you and is intended for your use alone. Do not share your with your colleagues or any other individual. All actions within the RxGov system are audit logged and attributed to you as the registered user. Please remember that additional agency members can receive training and their own individual accounts at any time to make requests. Now that you have an RxGov account, you can sign into the secure platform and start making requests. We will demo the system, so let's review the process. When you log in, you will enter search parameters that must match your subpoena or request form. You'll be required to fill in certain fields, and the data report will be created for you in both a PDF file format as well as a CSV, which is downloadable into Excel and any other spreadsheet software. You will electronically submit your subpoena and your request form. You do not need to send an original paper copy to our office. To request data from the PDMP, you will first obtain your subpoena or your signed request form. You will then log into RxGov, submit that request and upload your forms, and hit submit. PDMP staff will review the submitted request as well as PDMP legal counsel, reviewing the subpoena and request form for legal sufficiency. If you've requested the optional TAC review, your request will be sent to them with a 10-day business day countdown clock starting at that time. If you do not request TAC review and your request form and electronic submissions have been deemed successful, you will receive an email letting you know that your request has been approved. If there are any issues noted with your request, either the subpoena request form or the electronic that you made in RxGov, you will receive an email from the system telling you that your request was denied with information about that denial and how to fix it and resubmit. If your request is submitted successfully and approved, you will receive that email and you may then log into the system and download your RxGov PDMP data report. How can you avoid getting your PDMP data request denied? Here are some tips. When you're making a patient request, be sure to double check the spelling of the recipient listed on your subpoena and is entered in the RxGov platform. For prescribers, we always suggest using the DEA number or DEA numbers associated with that prescriber to make your request. That's going to give you the most specific results. You can, however, enter the prescriber's name if the DEA number or numbers are not known or you're not sure that you know all of the DEA numbers for that prescriber. If you search by name, you may be offered multiple DEA numbers in response. Only select the DEA numbers listed on your subpoena, even if the system has other possible matches. Otherwise, we may have to deny your request. A few more tips. If someone initials the subpoena on behalf of the clerk of the court, make sure you also submit the full name of the person initialing the subpoena. Legal counsel will be looking for that. Always double check the date range that you've requested in the RxGov system to ensure it matches the subpoena or request form exactly. This is probably one of the most common reasons we have to deny requests. Please also note that at this time, we're providing data in all schedules 2 through 5, and so your subpoena or request form should indicate that you're looking for all schedules or schedules 2 through 5. Remember, PDMP data are only reports of dispensing activity as reported by that dispenser to the program. The PDMP data are not considered an official record. Only the original prescription can serve as the official record. Therefore, investigators should confirm PDMP data by reviewing original prescription records. And although all efforts are made to ensure data accuracy, reports may contain errors or omissions. If you see anything in your data report that you did not expect to see, or data are missing that you did expect to have in your data report, or you have questions about quality or completeness of the data, please contact mdh.pdmp@maryland.gov, and PDMP staff will assist you with resolving your questions. We're now going to show you how to make requests for Maryland PDMP data in RxGov. Before we demo the system, we'd like to highlight a few changes from the RxSentry platform to our new RxGov system. Please note that your email address is now your user account name. You will not use your old RxSentry account name when accessing data in RxGov. You're able to reset your own password in RxGov, so you do not need to contact the MDH PDMP staff to reset your password if you forget it. When you retrieve a PDMP data report, you will be able to view the prescriptions on screen, as well as export a PDF or CSV report file format. Note that you do not need to select a report format when you're making the request. All views will be available to you when you retrieve a report. Additionally, approved reports will be available indefinitely, at least for now. You can always go back and retrieve data from your report queue later in time. If you make a request and immediately realize that there was an error or an issue with that request, you may rescind your request if it has not yet been viewed by MDH staff. The Investigative User Guide also goes over how to rescind a request, and we'll demo that. There are a few differences in the way that PDMP records are matched to identity in RxGov as compared to the RxSentry system. So we would like to highlight those. As PDMP records come into the RxGov system, they are matched to unique identities using a weighted algorithm that looks at several demographic fields in that reported data record and matches multiple records to a unique identity based on this demographic field. When you then make a patient search, it applies the algorithm and returns all identities that match the search parameters. Please note that when you make a request for a patient, you're going to give us a name and a date of birth. The date of birth will always be a hard match, but there will be name variations that are applied to your search request using industry standard tools. You do have the ability to select and deselect matches, so you have to select at least one option to populate the data report. This will become clear as you start making requests in the RxGov platform.
Welcome to the Investigative User demonstration of RxGov. When you want to log into RxGov, you'll see a screen like this. Email address and password are your username and password to use the system. But before you can use the system, you must first register for a username. To do that, click on the Register button, enter your email address, and create a password. This password is for RxGov. On this screen, you'll notice several fields. The required fields are email address, first name, last name, your street address, the city, state, and zip code, as well as the mobile phone number and the account type. When you click your account type, you want to select Investigative User. This will come up with additional fields. You can identify your agency, which is a required field. And the agency type, which is also a required field. And depending on the agency type, you'll be required to pick an agency ID or badge number. Once all the fields are filled out, you can click on Register. This will send an email to the administrator as well as yourself, so you can activate your account. This is the email that you will receive once you register for your account. You can see it says an account was created with Maryland PDMP RxGov using your email. To verify your email and confirm your account, click on the following link. Upon confirming your email, your account will enter a pending status. At that point, the administrator will fully activate your account. You simply click on this link. You can see by the message that you receive that your email has been confirmed. You'll receive another email once the administrator has activated your account. After the administrator has activated your account, you'll receive another email which reads, "You are receiving this email because your Maryland PDMP RxGov account status for rxgov.investigativeUser@gmail.com has been changed to active." Once you receive this email, you can log in to RxGov. Once you've completed the registration of your user, you can now log into RxGov. Use your email, which is your username, and your password that you created during the registration process. When you click on Login, you'll see an attestation text. This text asks you to confirm that you meet the qualifications of the authorized users. To read the document produced by the Maryland Department of Health, you can click on this link. That link will pull the document produced by Maryland Department of Health that includes the Maryland PDMP Investigative Users term of use. Please read this in its entirety. Once you have familiarized yourself with this document, you can go back to the login and accept the terms of use. Now that you're in RxGov, let's look at some of the screens. We can see who we're logged in as, Patrick Garrett. We see that there is a system notification. If we click on the system notifications, we'll see there's a test notification. If there are important notifications, you will be alerted in this window. For instance, if the system is out for maintenance, or there's some other event taking place that the administrator would like all of the users to know. You can change your username password by clicking your name and changing the information listed. You can click on Change Password. It will ask you to enter the current password and your new password and confirm the new password. Once you've done this, your password has changed. On the screen, there's menus on the left. There's Query, Submissions, and Tickets. The Query menu item is where you will submit your request for information. The Submissions menu will show you all submitted queries of any type. Query type over here by patient, prescriber, dispenser, or all. The tickets are tickets that you have created and have been closed. Either they've been approved or rejected by the administrator. In this session, we're going to show you how to request information on a patient. We will log in using the email and password that we created during the registration process. We must accept and attest that we are authorized users for the system. In this screen, we'll enter the first name, then the last name, then the date of birth, then our case number, and our start date, and our ending requesting date. And we'll add our legal document when all the required information is completed. We simply click on Submit. You see a message box appear that states our ticket was created and submitted to the administrator for approval. Once our request for information is approved, we'll receive an email. As we can see here, we received an email that our request for patient information has been approved. Ticket 102 has been changed to approved status. Since we received an email notifying us that the status of our request has changed, we can log in and look at the results. We attest that we are an authorized user. We click on Submissions and we see Ticket 102, which in our email stated that's what was approved, and that is approved. When we clicked on Approved, we see 2 bin solos. The plus tells us there's multiple bin solos that have been combined for this record as well as this record. We can see over at the address and phone number that one of them lives on 491 Industry Drive and another one lives on 400 Able Road. If we want to see the information on both of them, we click on the checkbox that says Display All. If we wanted just one or the other, we could have selected either this checkbox or this checkbox. As we scroll down to look at our data, we can see which prescriptions align to which patient. Simply by hovering over them, we can see which prescriptions align to which patient. At this point, we can download all the information to the CSV, or we can print it to a PDF. If we only wanted one or the other, we can unselect the bottom one and select the top one, and only download the CSVs and print the information for this particular patient. Or likewise, we can select the other one. If you wanted to know more about each one of these patients, you can click on their name, and we can see all the multiple phone numbers and all the different places that this particular person has lived. If we want to know more about the prescription, clicking anywhere in the row will give us more information. In this session, we'll demonstrate how to send a request for information on prescriber. We'll log in. Again, we'll accept that we have attested that we are a qualified user. And we'll click on the prescriber query. Because we know the DEA number, we'll type in the DEA number here. We'll type in our case number, the starting date of the information that we're requesting, and the end date for the information we are requesting. And we'll attach our legal document. And we'll click Submit. We get a message box saying that our request for information was successfully submitted. Once the status of our ticket has changed to approved, we'll get an email. Here you can see that our ticket 103 has been approved with the following comment: approved, reference 06032019. Because we've seen the status of our request change, we can now log in and review the results. We log in. We accept that we are an authorized user. We click on Submissions, and we can see that we are still on query type Patient. Because we made a request for information of prescribers, we want to change the query type to Prescriber. You can see ticket 103 has been approved. When we click on it, anywhere on the row, we can see the information requested. We see John Smith, our prescriber, his DEA number, and all the prescriptions that he has prescribed. We can print the information. We can download to a CSV. Printing it allows us to print to a PDF file. If we want more information, we simply click anywhere in a row, and we can see more information about the prescription. We can see all the patient information, the payment type, as well as the dispenser DEA. In this session, we'll show you how to request information for a dispenser. We log in. We accept and attest that we are authorized users. And this time we're going to request a dispenser information. Therefore, we click on the Dispenser Query tab. And because we don't know the DEA number, we can click on Show DEA Name Query. In the dispenser name, we can put the name of the pharmacy we're requesting information for, which is HID Test Pharmacy. When we click on Search, we'll see that the DEA number has been found for us. Click Select. The DEA number is automatically populated in the field. We type our case number, the start date for our query request, the end date for our query request. We add our legal documentation, and we click Submit. We get a message box stating that our ticket was created and successfully sent. We've received an email stating that the status of our request has changed to approved. Ticket 105 has been changed to approved. Approved reference 06032019. Because our ticket has changed statuses, let us go look and see our results. We log back in. Again, we accept the attestation that we are an authorized user. Once we log in, we click on the Submissions menu item, and because our query type was a dispenser, we change it to Dispenser. We see ticket 105 has been approved. We click on it, and we'll see our dispenser and all the information from that dispenser. We can print to a PDF file. We can download to a CSV file. We can click on the name of the dispenser to get more information. Or we can click on any one of these dispenses and find more information. Some cases you may fill out the parameters for your submission and make an error. In this example, we've typed in the wrong date of birth, which is supposed to be 10/31/1990, but we're also looking at the same year, only 19 days, May 1, 2019 to May 20, 2019. If we were to complete this submission, adding our subpoena, and submit, we can always go back at any submission and look at the tickets that we've submitted and see the ones that are open. In this case, we can see our error, May 1, 2019 to May 20, 2019. Because the administrator has not changed the status of our ticket, we can rescind the ticket simply by clicking on the checkbox and push resend. The ticket has successfully rescinded, and at this point we can go to ticket status and look at all of those that have been rescinded, and there it is.
Now that you've seen how to make and retrieve requests in the RxGov system, let's talk about next steps and points of contact. To become an investigative user, now that you've watched the training, you will complete the Investigative User Supervisor form and have your supervisor sign the form. You will also complete the Maryland PDMP RxGov Investigative User Training Attestation form, attesting that you have indeed watched this webinar. You will send both of those completed forms to the PDMP office at mdh.pdmp@maryland.gov. PDMP staff will review your forms and email you the Investigative User Guide and a link to the RxGov system to register for your account. You will create your own Investigative User account in RxGov. When making your account, you should choose the account type called Investigative User. You will then be asked to choose your agency type. You will choose the correct agency type based on your role. For example, if you're a licensing board investigator, choose board dash and then select the type of board that you're an investigator for. For law enforcement agencies, select law dash local, state, or federal. If you're an MDH agency, select MDH dash select your agency. And finally, if you're a fatality or medical review case investigator, you'll select review and select the specific subtype that matches your review case type. If at any time you have policy or technical questions and you need support, the MDH PDMP office is available, and we're your first line of contact. Our email address is mdh.pdmp@maryland.gov, and our phone number is 410-402-8686. Additional information about the Maryland PDMP, including not only investigative users, but also data submission, clinical users, and other activities that we are engaged with, can be found on our website, www.marylandpdmp.org. Thank you for viewing the Maryland PDMP RxGov Investigative User Training webinar. We look forward to assisting you in making requests for Maryland PDMP data.